Welcome to the Maternity Mentor. Today we will be talking about delivering twins and whether you really need to have a C-section. Stay with us. Hi, I'm Samantha. I'm a board-certified nurse practitioner, and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Despite what you have heard, having twins doesn't mean you are required to have a cesarean section delivery. Let's explore what delivery of twins looks like and what you can expect. Twin delivery is very dependent on the positions of the babies. Most babies will move around during the pregnancy, but between 32 and 36 weeks gestation, the babies will usually settle into their final position before birth. The first baby is the baby that is closest to the cervix or the bottom of the uterus, sometimes referred to as baby A. The second baby is often referred to as baby B. Understanding these positions or fetal presentations can help you understand what your options for delivery are. There are 6 possible fetal presentations. The first is vertex-vertex, which means both babies are head down. The second is vertex-breech, which means one baby is head down and one baby is bottom down. The third is breech-breech, which means both babies are bottom down. The fourth is vertex transverse, which means one baby is head down and one baby is sideways. The fifth is breech transverse, which means one baby is bottom down and one baby is sideways. The sixth and last fetal presentation is transverse transverse, which means both babies are sideways. Over 40% of twin births happen vaginally, which is good news for mothers. Vaginal birth is most easily accomplished when twins are in the vertex-vertex position. However, other fetal presentations may still allow for vaginal birth because the second baby's position can and usually will shift after the birth of the first baby. If baby B's position after the delivery of baby A isn't conducive to a vaginal delivery, such as transverse or sideways, your provider may try an internal or external version, which is manually moving the baby into a better position for delivery. Labor and dilation of the cervix only happens once in the birth of twins. Once you reach 10 centimeters dilation, you will enter the pushing stage to deliver the first twin. When your first baby has been delivered, your contractions may stop for a few minutes, allowing you a break before entering your second pushing stage to deliver baby B. Pushing the second time around is usually a lot easier and quicker, with the average time between the delivery of the first and second baby being only 17 minutes. If baby B is doing well in your belly, your provider will usually allow your body to naturally be ready to push again versus rushing things along. They may also use this break to examine you or use ultrasound to reconfirm the second baby's position. Vaginal deliveries with twins are a viable option for women if you are in good health and don't have any complications like gestational diabetes or preeclampsia, if both babies are vertex or head down, or if the first baby is vertex or head down. There are certain things that change in a vaginal delivery of twins compared to one baby. For starters, most facilities will have you deliver your babies in an operating room, even if they deliver vaginally. This is so that the delivery team is ready for an emergency cesarean section of the second baby if needed. An epidural will be strongly recommended by your provider for similar reasons. If an epidural is already in place, anesthesia can be quickly administered if surgery is needed. Assisted birth, such as the use of a vacuum, is more likely with twin deliveries. And finally, there's going to be a lot more people in your delivery. There are usually 2 teams of personnel to take care of the babies, 1 team for each baby. If your babies are being born prematurely, the teams will be larger and use more equipment than if the babies are full term. Additionally, the delivery team will include operating room staff in case a cesarean section is needed. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about cesarean section delivery of twins. Cesarean delivery with twins is similar to a cesarean birth of a single baby. Prior to delivery, your provider should counsel you on your options for delivery, including a scheduled cesarean section. Both risks and benefits should be discussed during this appointment so you can decide together how the best way is to proceed with the safe delivery of your twins. If you decide to schedule a cesarean section, it is usually scheduled between 37 and 40 weeks because it is common to go into labor earlier with twins. There are many reasons why you may require a cesarean section. These reasons include the first baby is breech or bottom down. The first baby is in an oblique position, which is kind of diagonal where the head is down but the body is sideways. Both babies are transverse or laying sideways. Previous history of difficult vaginal delivery with one baby. Previous cesarean section delivery. You have a placenta previa, which is when the placenta covers the cervix. Your twins share one placenta. Labor is progressing slowly. The umbilical cord drops down in front of the baby's head. Your blood pressure rises. You become unstable. Or an assisted vaginal delivery is unsuccessful. A cesarean section may also be required if your babies are experiencing fetal distress, which means they are not tolerating labor. Signs of fetal distress include meconium in the amniotic fluid, decreased oxygen levels, and changes in the heart rate and heart pattern. Combined birth or mixed delivery is when a mother delivers twins both vaginally and via cesarean section. Vaginal deliveries of twins most often take place in an operating room because there is a possibility that the first baby will be born vaginally and the second baby will be born by cesarean section. This is a rare type of delivery happening in less than 5% of all twin deliveries. Cesarean delivery after vaginal birth is usually caused by a medical emergency for baby B, which can include a cord prolapse or the cord coming down in front of the baby's head, cutting off the oxygen supply. Baby B's position being incompatible with vaginal delivery, such as transverse or sideways. Or placental abruption, which is when baby B's placenta detaches from the uterus prior to delivery. Research shows the possibility of cesarean section after vaginal delivery increases if baby B is smaller, because smaller twins do not tolerate labor as well as their bigger sibling. Twins are often born prior to 38 weeks gestation, with less than half of all twin pregnancies lasting until 37 weeks. This means twins often require special care after delivery in a neonatal intensive care unit or NICU. Given the chances of premature delivery are increased, it's important to choose a birth facility that has the proper resources to care for your babies. If your babies are very young or medically fragile, they may need to be transported to a larger facility for special care. If a premature delivery is anticipated, your provider may recommend a cesarean section to reduce complications for the babies during delivery. Finally, check to see if the facility where you are delivering has breastfeeding support. Breast milk is considered medicine for premature babies, so you will be encouraged to provide breast milk or breastfeed the babies directly. Breastfeeding twins requires extra support in the beginning. If lactation support is limited, reach out to local lactation groups for assistance. Delivering twins is very exciting, but does come with a lot of questions and concerns. I hope this has explained what to expect when delivering your twins and answered some of those questions you may have had. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.